Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about, does peeing prevent sexually transmitted infections? If peeing after sex can potentially reduce the risk of a UTI, particularly in females, it would serve to reason that it might also help prevent sexually transmitted infections, STIs. To date, there is no such evidence that this is true. This is because the route of infection for most STIs varies dramatically from that of a UTI. With a UTI, the bacteria will typically travel up the urethra to establish an infection in the bladder. With an STI, most bacteria enter the body through porous mucosal tissues that line the female genital tract and male urethra. Some STIs can even penetrate intact skin because they are so small. For example, E. coli, one of the bacteria most commonly linked to UTIs, is between 1.0 and 3.0 micrometers in size. By contrast, bacterial STIs like gonorrhea and chlamydia are between 50% and 70% smaller, while viral STIs like HIV and human papillomavirus, HPV, are vastly smaller than any of these. Because of this, peeing after sex offers little to no benefit in preventing STIs in either females or males. Prevention of sexually acquired infections. It is not always easy to avoid getting a UTI, but there are some measures you can take to reduce the risk of getting one through sex, particularly if you are female. In addition to postcoital voiding, clean your genital and anal areas before and after sex. Be sure to wipe from front to back to avoid transmitting bacteria from the anus to the vagina. Drink plenty of water before intercourse and just after intercourse to better ensure you can pee. Avoid using a diaphragm if you are prone to UTIs, as it can introduce bacteria into the vagina. Avoid spermicides, which can irritate and further weaken mucosal tissues of the urethra. The risk of any sexually acquired infection, whether a UTI or STI, can be reduced by lowering your number of sex partners. By doing so, you are less likely to be exposed to microorganisms that cause UTIs and STIs. To further avoid STIs, use condoms correctly and consistently. There is also a vaccine that can prevent HPV and a daily drug therapy called pre-exposure prophylaxis, PrEP, that can dramatically lower your risk of getting HIV. When to see a healthcare provider. You should see your healthcare provider if you have the following signs and symptoms of a urinary tract infection, whether sexually acquired or not: pain or burning with urination, feeling the need to pee often, passing only small amounts of urine, cloudy urine, strong or foul-smelling urine, lower abdominal pain or pressure, blood in the urine, STIs that feel like UTIs. Peeing after sex may help flush bacteria from the urethra and reduce the risk of getting a urinary tract infection, UTI, in females. With that said, the evidence remains split as to whether the practice actually helps. In the end, it may help and certainly won't hurt. Men are generally at low risk of UTIs from sex due to their longer urethra and the fact that ejaculation helps clear the passageway. The risk may be greater in men who engage in anal sex, although there is little evidence that peeing afterward helps. Peeing after sex has not been shown to prevent getting a sexually transmitted infection, STI, in either females or males. Urinary tract infections aren't fun. That's particularly true when you get a lot of them. If you have a history of recurrent UTIs, it is worth speaking with your doctor to discuss behavioral changes that may reduce the frequency of UTIs. Your healthcare provider may also prescribe antibiotics for you to use regularly or shortly after sex to reduce your risk of recurrent UTIs. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.